Hello everyone and welcome to our webinar. My name is David Mosley and I'm Director of Sales at ShareVault. Today's topic is how equity crowdfunding can help life science companies. The past 5 years have been a challenging period for raising capital in the biotechnology industry, especially for early stage companies. As a result, emerging biotech companies are increasingly pursuing alternative financing vehicles, including equity crowdfunding, to advance their drug development programs. I'll introduce today's speaker momentarily, but first I'd like to briefly cover a few logistical items. Although your audio will be muted in order to minimize background noise, we do encourage you to submit questions at any time during today's presentation via the question box located in your GoToWebinar control panel. There will be a question and answer session following the presentation. Questions which are not addressed during this forum will be responded to by email after the webinar. Our speaker has generously offered to make today's presentation available for download. After the presentation, you'll be invited to a ShareVault where you can access the PowerPoint deck. And lastly, we'll notify you by email next week when the webinar replay is available for viewing. ShareVault provides secure document sharing solutions to companies and organizations involved in high asset value transactions like fundraisings, M&A, and partnering events. Our service brings security and efficiencies to your transactions so that you can remain focused on bringing your project to a successful close. So let's get started. It's my pleasure to introduce Scott Jordan, an accomplished life sciences business development and investment banking professional. Scott has more than 20 years of corporate experience in negotiating strategic corporate alliances, securing international licensing agreements, building national sales teams, and successfully bringing product through development, approval, and launch. We're thrilled to have you here today, Scott. Please feel free to begin your presentation.
Hi, welcome to the How Crowdfunding Can Help Life Science Companies webinar co-hosted by ShareVault and S. Jordan Associates. As David mentioned, my name is Scott Jordan. I am the CEO of S. Jordan Associates, a Chicago-based healthcare consultant, investment banker, and partner at Crowdfund Connect, which is a designer of crowdfunding portals for registered broker-dealers. For full disclosure, Crowdfund Connect is a consultant to Healthios. Healthios is a Chicago-based healthcare investment bank, and the company's crowdfinance portal, Healthios Exchange, is profiled during this webinar. The agenda today is 7 topics. What is crowdfunding? Why is it interesting? Will crowdfunding work for life science companies? How can I participate? Low profit, limited liability companies, specifically L3Cs, a case study on Healthios Exchange, and crowdfunding highlights. So first up is, what is crowdfunding? Crowdfunding describes the collective effort of individuals who network and pool their resources, usually via the internet, to support efforts initiated by other people and organizations. The industries that have best qualified for crowdfunding traction, or have a history here in the last 2 or 3 years, is software, gaming, media, film, and music. Let's take each one of these in particular. In software, Pebble Watch, a customizable watch that can display messages from a smartphone connected by Bluetooth, secured over $10 million in funding from 68,000 backers in 34 days. In the gaming industry, which on Kickstarter is the most money pledged of any category, they've raised over $83 million to date in the gaming area. One of the companies that listed is Double Fine Adventure, a point-and-click adventure game, raised more than $3 million. In the media and the film, 10% of the films at the Sundance Film Festival in 2013 were funded through Kickstarter. And in the music sector, that sector had the most funded projects via Kickstarter of 5,000 projects funded. Even though crowdfunding in the life science industry is in its infancy, an example of a successful capital raise via crowdfunding was an emerging growth biotech firm called Bio. This firm was the first complete virtuous cycle for crowdfunding applied to biotech startups. 300,000 euros was raised and used to validate the company's technology and molecules, essentially reaching proof of concept. and the company's goal was to attract follow-on investors/angels. The data attracted via the fundraising, a second investment from a business angel, which in turn led to an undisclosed drug discovery player acquiring the crowdfunding holding. This allowed YSeed, which is a crowdfunding portal located in France, and more than 200 small investors to exit with a profit. When we take a look at crowdfunding, there are most of the time there are four primary platforms that are important. First is the donation side, where contributions are given in the form of donation, and donors are motivated by social earnings. From the donation perspective, a key example of a company that has used donation crowdfunding essentially is I Am Scientist. There's a company called I Am Scientist that utilizes the donation crowdfunding. And essentially, the nonprofits and charities have a long history in crowdfunding life science projects in the form of large numbers of small donations, such as through sponsored events. Secondly is reward-based crowdfunding. Contributions are given in the form of donation or pre-purchase. So Kickstarter would be an example of this. Donors are rewarded by rewards and perks. The company in the rewards-based platform, MedStarter, is a company that has three facets to their business plan under rewards-based crowdfunding. That is, startup gets non-dilutive financing and the market validation to help it grow to the next stage. The platform is designed specifically for healthcare, where doctors, patients, hospitals, pharma, and payers are all important backers of innovation. It enables a highly motivated population to support and directly affect the change that may help make them or their loved ones healthier, or essentially what we call compassionate use. Thirdly, and less used as far as in the life sciences area to date, is peer-to-peer, where contribution is given in the form of loans. The lender is motivated by desire for reward or intrinsic gains. And lastly, of importance to many life science senior level executives, equity, or contributions given in the form of equity, or specifically the Jobs Act, which we'll review. In this instance, investors are motivated by return on investment. And companies in this space include XUS, Crowdcube, Seeders, YSeed. In the U.S., the two of the leaders are Circle Up and Funders Club, both located in the San Francisco area. This slide is a graphical representation of the crowdfunding platforms available to life science companies. Crowdfunding of accredited and non-accredited investors was empowered by Title II, Title III, and Title IV, which you can see towards the center and in the right-hand side of the slide. The Jobs Act, which stands for the Jumpstart Our Business Startups Act, was signed into law on April 6, 2012 by President Obama. The SEC had 270 days to create rules and regulations to approve this act. Unfortunately, there's been a number of factors that have contributed to the delay of this act itself. First of all was the head of the SEC, Mary Shapiro, stepped down. Second of all, there's been some delay tactics, we feel, by Senator and SEC regarding the fear of fraud, for example. And the other thing is FINRA doesn't report directly to Congress. So we've been trying to encourage the regulatory agencies to approve this act as soon as possible. We're looking at late 2013, probably 2014, until the act is actually passed. The Jobs Act, let's review the Titles 2 through 4 in more detail in regards to crowdfunding and life science industry. These three acts are probably the most applicable to those emerging growth companies and investors seeking to raise capital through crowdfunding platforms. Title II, which essentially refers to, it's in conjunction with Reg D, or accredited investors. There's two parts of the act which are of primary importance. Number one is general solicitation, and the second one is that the Title II of the Jobs Act raises the shareholder cap from 500 shareholders to 2,000. In regards to general solicitation, prior to the Jobs Act, Reg D prohibited the general solicitation and advertisement of securities and Rule 506 offerings. Issuers needed to have some pre-existing relationship with potential purchasers before conducting a private placement. This created a significant limitation on the issuer's ability to find and raise capital in a competitive process. Following approval, or when and if the Jobs Act is approved by SEC FINRA, Title II of the Jobs Act will reverse that limitation and allow for the general solicitation and advertisement of a Rule 506 offering as long as all ultimate purchasers are accredited investors. By removing the ban on general solicitation, companies will not have to rely solely on existing relationships for funding. As a result, a wider audience of investors can be reached by the Internet, seminars, and other venues. Secondly, under Title II within the Jobs Act is raising the shareholder cap from 500 shareholders to 2,000 shareholders. This is the threshold for when companies are required to go public. Of importance, and especially under Title III, which I'll describe in a few minutes, the original holders of crowdfunded securities will not be counted toward the shareholder limits under Section 12G of the Securities Exchange Act, which can cause issuers to become reporting companies. Under Title III, which refers to crowdfunding specifically to non-accredited investors, this title creates an entirely new exemption for the registration of securities offering structured to take advantage of the Internet's capacity for mass communication and social interaction. Essentially, it extends the promise of making entrepreneurial investing of the type previously the exclusive realm of venture capital funds and wealthy individuals available to the vast majority of potential investors who do not qualify as accredited investors. As in Rule 506 Reg D offerings, crowdfunding securities are covered securities, exempt from state registration requirements, but not from enforcement of state anti-fraud laws. The issuers, the emerging growth companies, of crowdfunding securities cannot advertise the terms of the offering other than by providing notices that direct a potential investor to crowdfund intermediaries as listed on this slide, number 1 through number 3. Let's take a look at these intermediaries in more detail. The broker-dealers, number 1, are required to have SEC registration. The broker-dealers can also solicit investments and recommendations on the behalf of issuers. The second intermediary defined by the Title III of the Jobs Act are funding portals. A funding portal is exempt from registration as a broker-dealer, but is subject to SEC authority. The funding portals are not permitted to offer investment advice, solicit purchase or sales of the crowdfunded securities offered in its website. It cannot compensate employees or others based on the sales of crowdfunded securities or hold or manage investor funds. Lastly, number 3, service providers. These individuals will not have to register as brokers or dealers simply because they co-invest in the securities, or they provide ancillary services such as due diligence or providing standardized documents in the offering of these securities. When we look at Title IV, Title IV refers to Reg A plus or accredited investors, many times defined as mini registration. So what the Jobs Act tried to do with Title IV of the Jobs Act was to increase the appeal of Reg A, which was an existing regulation for issuers, by adding a new exemption many have referred to as Regulation A plus. Regulation A plus raises the maximum amount that may be offered from $5 to $50 million. So why is it interesting? Why is crowdfunding interesting? Well, one of the reasons it's interesting is that it allows non-accreditors to invest in private companies. So for investors that have annual incomes of net worth of less than $100,000, they can invest the greater of $2,000 or of their annual income or net worth. Secondly, annual income investors that have annual income net worth greater than $100,000 can invest up to 10% of their annual income or net worth, or up to a maximum of $100,000. The second reason why crowdfunding is interesting is that it fills the funding void left by VCs. Over the last 10 years, the number of venture capital active firms investing more than $5 million over the past year has declined from 1,022 firms, venture capital firms, to 462. The funding void can be filled via 3 different platforms: seed, bridge, and what Healthios Exchange calls sidecar financing. On the seed side, we're anticipating companies raising from anywhere between $0 to, say, $300,000 or more in seed financing through non-accredited investors. On the bridge side, that amount could be raised from $500,000 to $1 million. Keep in mind that the limit per company is $1 million capital raise. On the sidecar or follow-on capital, this refers to basically follow-on capital to venture capital-backed companies. So for Healthios Express, which is a case study that we'll talk about later, the Express offerings, which is the brand name for Healthios Exchange, is essentially their sidecar platform, is to raise $1 to $5 million from accredited and non-accredited investors. The non-accredited side of the equation is dependent upon the approval of the SEC, FINRA approval later this year in 2014. Most, if not all, actually here in the United States, it's all crowdfunding platforms can only raise money from accredited investors, whereas ex-US firms, such as Seedrs and Crowdcube, have been crowdfunding non-accredited investors. The value proposition for sidecars, express sidecars for the venture capitalist is assistance with raising lower amounts of capital where they do not want to approach their syndicate or their LPs. It's just too much time and effort to do that, say $1 to $3 million. The other value proposition for express sidecars is that it combines accredited investors into special purpose entities, meaning the fragmented cap structure is not a concern. The crowdfunding investors represent one shareholder in a cap table. The value proposition for sidecars, specifically Express, for investors is that they get to invest alongside premier venture-backed companies. They have potential near-term exits, and third-party valuation is established already. Lastly, these last 2 points, why is it interesting? Kickstarter has been very successful raising money this past year. 2.2 million people pledged $319 million to Kickstarter-backed projects. And crowdfunding is enabling the tools to raise capital from accredited and in the future non-accredited investors via easy-to-use web-based interfaces, e-documents, and payments. So will crowdfunding work for life science companies? The key question for life science executives seeking development financing through crowdfunding is, can I raise enough money to meet our capital-intensive development programs, and how do I attract investors who can invest in sectors with higher probabilities of success, and those sectors that have less risk, i.e. consumer internet? The answer to this question, most likely, is that crowdfunding alone will not meet your entire capital needs. That companies will have to aggregate various sources of capital to meet capital needs of the capital-intensive needs of their companies, seed to exit, or what we call under Title II, hybridization, or the aggregation of disparate sources of capital to meet development financing needs. One of the prime examples of hybridization of capital is these Healthios Exchange sidecars that we just discussed before under Title II, Reg B. The traditional sources of capital available to most life science companies are charities, non-equity sources such as charities, grants, foundations, equity, friends and family, angels, and venture capital. The non-traditional sources is what we're talking about today, which is crowdfunding platforms which include donor, reward, peer-to-peer, equity. Those are the primary crowdfunding platforms available to life science companies. So when we state that crowdfunding alone most likely will not meet the request or the demands from companies in a capital-intensive industry, what's the data supporting that so far? And by the way, this is the real early stages of crowdfunding. But backing up that premise. So for a crowdfunding platform in Australia called ASSOB, they're an Australian-based equity crowdfunding platform. Their average raise is $734,000 per company. Circle up, a Reg B platform in the consumer goods industry. Their average raise is $826,000 amongst 8 deals. Their highest thus far this year is $2.3 million, and their lowest is $500,000. The Funders Club, based out of San Francisco, that uses a managed venture funds model exemption. Their average raise for tech-based companies is $328,000. They funded 7 deals. Their highest deal thus far is $509,000. Their lowest is $87,000. And lastly is Feeders. That's out of the UK. That's the ex-US equity crowdfunding model. Their average raise is only $48,000 over 9 deals. Their highest is $96,000. Their lowest was $28,000. So then the first question you might be asking is, why is there such a discrepancy between, say, Circle Up, that's using a Reg D in the consumer goods industry with $826,000, and Cedars, whose maximum is $48,000? The answer to that question is that Circle Up is focused largely on accredited investors, and they deal with later stage companies versus Cedars. The answer to attracting investors to an industry with high failure rates, such as life science, the way to overcome that, in our opinion, is to appeal to investors' profit and philanthropic goals, which is unique to the life science industry, or what we call compassionate use. The way one of the strategies we feel that you can utilize to attract investors to the sector versus, say, consumer internet or software is providing a platform where the investors have access to lower investment thresholds, so those investors can diversify across many startups, early stage companies. Lower investment thresholds can be utilized to assist emerging growth companies raise seed capital under Title III, and in this instance we're looking at seed financing and the bridge financing that we mentioned earlier. The seed financing largely can come from friends and family and accredited investors, where we see bridge financing, the primary structure will be convertible notes. So how can I participate? This is a summary of the 4 platforms that have been discussed thus far in this webinar. Actually, L3C is actually next. But L3C Foundations is basically a non-dilutive, and we're going to go through a case study with the Vertex Cystic Fibrosis Foundation and the approval of their state-of-the-art treatment for cystic fibrosis. The Equity is the second platform that's available. Equity platforms for accredited investors here in the U.S. utilizing the Reg D Rule 506 exemption. In this case, we have 3 companies: Healthios Exchange, Funders Club, and Circle Up. The last 2 companies are primarily focused in tech and consumer, the consumer goods area, whereas Healthios Exchange is primarily healthcare/life sciences. The third platform is the Equity in the non-accredited and also accredited in the ex-US, the Crowdcube, Cedars, and ASSOB out of Australia. And lastly, there are non-equity donation-based models like Donately, and that's just an example there. So those are the 4 platforms that are available. When we talk about non-dilutive areas of financing, which is of interest to many emerging growth companies, the L3C is one of the areas that there's a lot of the investors are unaware of. And in this case, the L3C stands for Low Profit Limited Liability Company, which bridges the gap between nonprofit and for-profit investing, facilitates investments in socially beneficial for-profit ventures. It's easier to attract investments from foundations and private investors under this platform because it simplifies the compliance with the IRS rules for program-related investments, and foundations satisfy their obligation to distribute 5% of their capital per year under this platform. One of the companies, the case study I wanted to talk about is the Vertex Cystic Fibrosis. So they have a new compound called Calitico, which is a new oral medication for the treatment of cystic fibrosis, approved by the U.S. Food and Drug Administration in January 2012. This drug is the first available that targets the underlying cause of cystic fibrosis a faulty gene in its protein product, CFTR. The L3C model is a refreshing alternative to emerging growth companies seeking capital through the grant process and also through charities. The legacy model that's still being largely used today is established foundations contributing capital to charities and to academia, and then those companies may or may not invest in for-profit companies. The Vertex cystic fibrosis model is proof that the foundations and charities evaluating their opportunities, that there can be direct investments in for-profit entities without disturbing their tax-exempt status. The Healthy US Express program is going, the Healthy US Exchange program is going to include a foundation L3C model to assist emerging growth companies to source capital from foundations directly, similar to the Vertex Cystic Fibrosis Foundation model. A case study that I wanted to pass by the group today is Healthy US Exchange. It's a crowdfunding portal that I am personally involved with building the engine and consulting with Healthy US. The Healthy US Exchange is basically, we think it's going to revolutionize the raising of capital via crowdfunding. The value proposition for crowdfunding in the life sciences industry is very great. The Healthy US Exchange platform, it leverages the best of technology to bring dramatic efficiencies to the financial markets. It connects investors and companies more transparently than ever. It magnifies the visibility and access to investor networks across the globe. And it changes the status quo, meaning the intermediaries that are controlling the fragmented private funding marketplace and often reap the perverse benefits from asymmetric information and market inefficiencies. In this case, the intermediaries, which provide much value to the ecosystem, the angels and venture capital. The platforms like Healthy US Exchange will enable investors to make investments directly into private companies. First, the accredited investors, and then subsequently, with the passage of the Jobs Act, the non-accredited investors can participate as well. In this case, you can see the opportunity, the problem, the context, and the solution. And essentially, from a solution perspective, the Healthy US Exchange will be financing healthcare. It's set up basically to make this link between investors and emerging growth companies, but not trying to alienate the angels and the venture capitalists. So the venture capitalists and the angels will be active participants on the site. Healthy US will have tools, all the tools necessary to do the due diligence, to work with the communities of investors, to have direct contact with the investors can have direct contact with emerging company management. Right now, the database has got 100,000 accredited investors. We've got exclusive listings of 91 market segments, and it's focused primarily on seed to exit, meaning crowd finances non-venture-backed companies, so raising crowdfunding capital from accredited investors for non-venture-backed companies. Foundation Place is what we talked before, which is the L3C platform. It's essentially raising capital from foundations. Express is an offering and a portal, which is the sidecar capital for VC-backed companies with institutional sponsorship and projected 12 to 24-month exits. An in-market and LiquidNet on the in-market side, that is the liquidity vehicle, which is essentially Form 10 direct listings. That's also OTCBB, given that the IPO, the markets have been largely closed. That's changed, by the way, recently. But the route, there's companies that are actually taking different routes to liquidity, including reverse mergers. Lastly, LiquidNet is an interesting area regarding secondary trading. So essentially, just to talk about secondary trading for a minute, Many of the industry leaders right now are partnering with firms like Circle Up with second markets. Also, I think there's a few firms. Angel List is with second market, for example. So in this instance, what are these crowdfunding platforms hoping to achieve by partnering with second market? And essentially, what they're looking for is they're looking for the primary and secondary trading capabilities of these platforms and access to accredited investors. In the case of Circle Up, they essentially are not, as far as what we can perceive, in the business of trying to go out there and find a lot of accredited investors, and so they use second market to bridge that gap. The second thing, so that's primarily the second thing is that's the primary buying of the securities. The other thing that's very important is on the secondary trading of the securities, accredited investors are allowed to buy crowdfunded securities that have been held for less than 12 months, while the non-accredited cannot. So the efforts by Circle Up and Angel List to partner with second market, for example, are examples of bringing liquidity to this 12-month quiet period for non-accredited investors. And it's a very valuable area. The other area that you see from a partnership perspective is firms like Circle Up with their broker-dealer W.R. Hambrick, early shares with Point Capital Partners, and crowdfunder Gate Global Impact. And so there's a lot of crowdfunding platforms that are actually seeking broker-dealers so that they can invest, they can solicit investors. So once again, just in our case study here, Healthy Health Exchange will provide the tools and the platform to enable emerging growth companies in the life sciences, medical device, diagnostics, healthcare information, HIT, and healthcare services areas, raise capital from the sources of capital, include the accredited investor, the foundation, the venture capitalists, the angel investors, and then also a group that's becoming more compelling, which is family office. Recent studies have shown that family offices are hiring more people to make direct investments. Even in private companies, they typically made investments in EBITDA positive, like say private equity deals. And now, especially families ex-US, especially in the Middle East area that we've been networking with, are looking for those game-changing life science technologies, the future pharmacyclics, the future Regenerons, Vertex, Alexions, etc. From a highlight perspective, if we look at the crowdfunding highlights of our talk today, the benefits of crowdfunding are visible to you on this slide. And the four constituents, the issuers of crowdfunding securities, essentially privately owned life science companies, the investors, which I just profiled, the portals, such as Healthy Health Exchange, also Circle Up, Funders Club, etc., Cedars, the broker-dealers behind these companies, such as W.R. Hambrick and Healthy Health. And if we go around here, you can see terms that we talked about, such as hybridization, which is the accumulation of capital across many different financing sources, the ability to diversify for investors, the access to startups, more importantly, the ability to diversify, taking those two together across startups, and equity and non-equity platforms, easy-to-use web interface, new revenue sources for broker-dealers, general solicitation, ability to access. There's absolutely a incredible value proposition, a wave coming here to a industry finance that has been largely shielded from disruption, such as music, film, and some other areas. Lastly, I'd like to definitely talk about ShareVault. Been invaluable to my business at S. Jordan Associates. My clients are very, as all clients are in life sciences, very, very sensitive about their IP, and we use data rooms effectively within S. Jordan Associates, and in the future we will utilize them for within the Healthy Health Exchange. So I just would like to say that ShareVault, I want to thank them for allowing me to speak today on the subject. It's got a lot of facets to it. I expressed a lot of information here, but be more than happy to talk to each and every one of you on a one-on-one basis and look forward to participating on our next webinar.
Scott, this is Steve Joseph speaking. Before we go ahead with the Chevrolet demo, and actually the more important piece is your Q&A session, I want to thank you for the detailed presentation on a very hot topic, which, as you pointed out, is especially important to life science companies right now that are desperately need to find other fundraising options. The information, obviously, is also very helpful to prospective investors. So we're going to come back to the Q&A in just a moment. Please, for our audience members, please continue to submit questions that you have for Scott. And while we're compiling them, I'll be doing a brief demo to illustrate how ShareVault's virtual data room is used as a platform for an exchange, whether that exchange is used as a partnering exchange or, as in this case, an investment purpose. So we'll come back to the Q&A shortly. Let me switch to the demo now. And I'm going to start by logging into an exchange that we've called here Novalera that's been set up previously. Novalera is an investment exchange. And I'm going to log in as a guy named Jim Markham, who is an investor, and both has some current investments as well as some new investments that he might be interested in. Typically, in any kind of exchange or platform that you're joining, there's a confidentiality agreement that's a reminder of the security of the information. And what you'll see here is that there's a category of current investments and a category of investment opportunities as well as investment forms. Actually, what I want to see is maybe there's not much new, so I can't see that there's any new documents, but there's some specific documents in my current investment. And this is an investment that I'm being shown that is my investment. I can go down through a whole category of information. What I care about as an investor is the current financials. And let's take a look at the cash flow forecast specifically, because that's partly my cash that's at stake here. You'll notice when I select the document, I'm actually opening it up in a window that's a typical Adobe Reader window. I can even go to full screen with it. And I can zoom out. If you'll notice, when I zoom out, it actually has a watermark on it. And this watermark does illustrate both the fact that I'm the one that's logged in and looking at this. Let me scroll down here a little bit. It's got my email address. It's got the date and time that I'm logged in, and it's got the IP address that I'm at. So Novalera and the company that is my deal, Therapeutics, that's my investment, has actually still got some protection on here, including the protection that I can print this document, but I actually can't save it. So I can make a hard copy of it, but I cannot save this document. It is a protected document. I could go to other elements of this and see what was happening potentially on the business development side, and if there was a market research study that I was interested in that might be relevant, I could look at that. And this document is the same kind of thing. You'll see that there's let me get the center of the watermark here. You'll see the watermark a little bit more visible, and it's showing some of that same information that I just described. So that's on sort of my current investment. Let's go to possibly a new investment opportunity, and let me expand and see what's available to me. Looks like I've got something available to me that's called New Wave Bio, and there's an overview document that I could take a look at. And it's this drug overview, or I could go down into some product development information and even into some preclinical. Let's look at the preclinical information. And this is where I could learn some things, a variety of things about the drug as part of making my decision. So if I want to look at any specific area, I can do that. Here's some information that may be related to the capsule itself, the packaging for the drug. There may be some other information that I'm interested in. And again, there's a watermark on this. Let me go to another document here. I'll pick this one that may have some analytics from some of the studies that have been done. And here's the studies that you're seeing. Notice in this case there's another watermark as well, but also that I cannot either print or save the document. This is not a document that for a company that I'm yet invested in, and therefore there's an even greater concern about security with my not being an investor as to what level of access I'm given. That's the kind of information that I can get as an investor. I can also use the Q&A forum here to submit questions, which I've done one previously, is have there been any good signs of significant toxicity? And I'm actually referencing a specific document here as part of this. So I both have the question and reference to this toxicology document, and I received a response that that addresses my question from somebody in the Novalera or other environment. Let me log out now as, let me do one more last thing just to show you the relevance of this. If I am still interested in this category of toxicity, I can also do a search. And search will very quickly find out the documents that are relevant to me under New Wave Bio. I can see that there's something in preclinical. I can see that there's a document under IP here if I want to look at that single document under IP. There it is. It's got identified the toxicity element to it, and I can read further on that. Okay, I'm going to log out now. I've shown you the user and investor side, an accredited investor view. I'm going to very quickly show you what happens if I'm a company that's using the Novalera exchange to distribute some information for a fundraiser. Let me go back to Novalera here. So I'm now logging into the Novalera platform, Novalera Exchange, as an investor. And there's not a lot of documents in here. Actually, there's just one document, or two documents. One that's the Form D that's required for me to file for accredited investors, fundraising with accredited investors. And then there's the Novalera anchor document. It's just a placeholder document. I've got a structure that's been defined for me here at a company called Cellgenics. That's my company. And I've got some categories for these documents. So I'm actually going to quickly, and it will be very quickly, upload them, and you'll see that in just a moment. Let me bring some financials over. I'm going to bring some intellectual property documents, and notice I'm just dragging folders over, and I'm going to bring some development documents over. So I've got three categories of documents here that I've now dragged into the staging area, and I can then go back to the categories list that's been defined for me and say what I want to do is actually take these documents, the clinical documents. I actually have some clinical documents, and I'm going to bring them in and put them over here in this category. And upload these documents. So I've now put these documents in here. So the documents are being published, and I put some of the documents in these categories, but there are other documents that I didn't yet categorize, and I'll be able to categorize them. Or actually the Novalera administrators will be categorizing those documents so that they can be seen. But I've now completed uploading a set of documents that now can be distributed by the Novalera Exchange administrators to a set of investors, and those can be existing accredited investors. When the Title III and the SEC rules come out, hopefully they'll be available to unaccredited investors as well. There's a lot more to ShareVault than what I've just shown you here. I wanted to show you the two sides of it. So we now have these documents that have just been uploaded and are available for access externally. Again, I've got the search engine, and I can use the Q&A forum as well. There's I haven't shown you the administrator side. We're happy to show you that. It's about as easy to use as what I just showed you with ShareVault, and from the user side. And we encourage you to call us to learn more. Now let me switch back to the question section. So if you haven't submitted questions yet and you still have questions, please go ahead and submit them. Actually, I need to bring up the question box here. So we're going to be asking these questions of Scott. There is just a couple of questions that we commonly get in this situation or during a webinar, and that is, will the slides be available, and is there a recording available of the webinar? To answer those questions, the slides will become available. You'll get notification of slides being available, and you also will get information about the recording. It should be available on our website sometime next week. Okay, Scott, we're going to get to some of the questions, and let me find the first one here on the list. What would investors of the company think of accredited investors? What would investors think of the accredited investors? I'm not sure whether they would be pleased with that.
Are they referring to who, as far as who's reviewing the accredited investors? Who's talking about the company?
I think they're referring to the existing investors.
Yeah.
So, you know, if there's some existing investors and you come along with some new accredited investors,
right,
what's the reaction of the existing investors who may be venture capital or?
Yeah, I think historically it's not been I don't want to be absolutes here, but it's not typically too welcomed from the fact that retail investors can oftentimes be litigious, and fractured cap structures are very hard to manage from a communication perspective. But the new crowdfunding tools are being executed are essentially making it more palatable, making retail investors as a group and special purpose entities, making them look more like institutional investors. Limiting, putting the power into one shareholder vote versus having a much fractured cap structure. The fact that they're raising it from 500 to 2,000 investors, the shareholder cap, does open the door. That would be the other limitation that the existing investors would not like, would be the stipulation that if they hit 500 investors, which is easy to do under crowdfunding, that they would be forced to go public. Either that, or they'd have to have their employees list their shares on second market to try to get liquidity. So that would be my answer to that.
Thank you. Another question. I would be interested to hear a comparison of L3C companies versus B Corps.
Yeah, I'd love to have the discussion offline because it can be somewhat complex, and I am not an attorney by nature, but we have a staff of attorneys that are assisting us with this L3C platform. The L3C, you have to be very as far as from a C Corp or this L3C, on the L3C side, you have to be very sensitive about constructing a organization with such a component because charter, due to the fact that foundations can, if it's not approved, if it's not transparent, the foundations can be at risk of losing their tax-exempt status, which has prohibited the proliferation of L3Cs. But that's changing. Because we're incorporating standardized forms and communication with IRS, et cetera, to make sure that our investments comply with all rules and regulations. But the true answer to that question would be better suited for an attorney.
This next question may also be an attorney question, but I'll let you decide that. How does the LC3 tax treatment compare with a nonprofit 501c3 tax-exempt status?
Yeah, I'd have to get more clarity myself on that as far as from the differences between those two tax-exempt charters. The L3C platform, like I said, we're building it up, and I'd be more than happy to put you in touch with the right resource.
I know during your one slide you did mention some of the non-U.S. companies. It looks like somebody here is asking if there are any others that are currently using equity crowdfunding.
There are. I mean, let's face it. on the equity side, it's much more limited than it is on the donor reward-based side. I mean, here in the United States, we have, I think there's 900 or 1,000 companies that are actually portals. What we focus on are companies that, you know, have an equity focus, and also we focus, you know, that's primary. That cuts it down to a manageable size because you need a broker-dealer. So the majority of these firms that want to, these say programmers or industry insiders that want to start a portal, one of the conditions as in the slide was that they have to partner. They have to be a broker-dealer, or they have to you know, establish their own or partner with a broker-dealer. So yes, the answer to the question is there are other companies. A lot of them are waiting on the regulations to pass. I mean, you've got Crowdfunder, WeFunder, Seed Invest. Those are all U.S.-based companies. You've got Grow VC, which is a firm out of, I think, Singapore. You have additional ones in Europe. So it's a fascinating place to be. Yep.
Question is asks about a Middle East collaboration that you mentioned. Can you talk a little bit more about that?
So this is our opinion. We just had I was working with Healthios. They had their annual summit, investor summit in Deer Valley, and we had a group there that represented 25 Middle Eastern families. Very interesting to see the dichotomy between Middle Eastern or ex-U.S. families, in this case Middle East, and U.S.-based family offices. The ex-U.S. family offices are more open to non-asset-backed type, non-yielding type investments, non-control investments in private companies. So we really feel that if structured correctly, this portal, Healthios Exchange, can help facilitate that asset class that's been largely untapped for private companies. But the Middle Eastern families in particular, they're looking for trophy. I mean, I don't mean that in any disrespect. They're looking for what they call trophy-type opportunities. It's just not real estate, but you know, game-changing, you know, new, like say cancer stem cells, epigenetics, you know, those types of game changers in the life sciences area.
Number more questions. I don't know if we'll get to all of them, but here's a good one. What's the best way to use crowdfunding for a small life science company that is already public? What are the primary limitations?
Well, essentially, crowdfunding as it stands right now is largely slated to private companies. There's not much application, at least for us, in the public markets. You know, there's the liquidity event there, and you know, most people are as far as raising, you know, pipes, etc. That's something that we're looking at. The rules and regulations are evolving, and that will be within our in-market. That will be within our in-market portal.
Another question is, can non-U.S. companies use the vehicles that you've been talking about?
As it stands right now, these U.S.-based companies crowdfunding, the Jobs Act pertains to U.S. domiciled companies. It does not include ex-U.S., but those could change in the final regulations. But there's definitely, obviously, there's a plethora of companies, ex-U.S. crowdfunding portals / broker-dealers that we feel are CrowdCube, YSeed, that are very good crowdfunding portals.
We're getting close to the end here, so let me pick one more question. How are valuations set for early-stage companies that work through Healthios? Is it the same with W.R. Hambrecht, to your knowledge?
That's a great question. Yeah, it's similar, if not the same. I mean, if there's not a venture round or some kind of a third-party validation, such as a strategic investment, et cetera, then Healthios is in as good a position to help establish valuation, since we do that as Healthios does that as an investment bank. So they're in a very ideal position versus some of the other firms that are out there. The funders clubs, Circle Up actually has an advantage as well with W.R. Hambrecht. We feel that the broker-dealer side of the equation, as far as getting a premier crowdfunding broker-dealer to assist you with valuation, is one of the key aspects of success. Just like with Kickstarter and the donation reward side, as far as marketing, et cetera, and doing videos and building up, we feel that the broker-dealer component, the quality of the broker-dealer, the expertise of the broker-dealer, the ability to originate deals and their relationships with institutional capital is paramount to success through equity crowdfunding.
Okay, we're going to make it one last question. The question is, it's early days, of course, but should academic labs with sexy projects develop a competency at this like they have developed grant applications? If not them, who should on their behalf? Tech transfer offices, firms like yours, or FreeMind, BD consultants?
Well, that's another great question. In academia, these new tools, there's other crowdfunding platforms that are more focused to the transference of IP and assets from labs, academia to into fully integrated private companies. That's not. We're a little bit further down the value chain with venture-backed deals and private companies and the crowd finance portal. But I think that the crowdfunding is an ideal platform for academia to circumvent or augment the ability to raise capital, given our budget deficits and the pressure that's being exerted upon grants. So we think that's going to get harder and harder, and we think that the crowdfunding, especially for people that are passionate about Alzheimer's, CNS, other CNS conditions, et cetera, Parkinson's, some of these things, cancer. We really believe that the compassionate use side will definitely become a value going forward.
Okay, I'm going to wrap up now. Scott, thanks for the responses to those questions, for your earlier presentation, and just for the general education and perspective you've provided our audience. I'd also like to thank the audience for your attendance and invite you to join our next Linda Pullen webinar, which will be taking place in March. You can see the schedule and the topic on this webinar on ShareVault's website, along with recordings of both Linda's past webinars as well as other webinars that we've done. Again, just to remind everyone, a recording of this webinar will be available next week on our website, and all participants will receive an email explaining how to get copies of the slides. So thank you for your attendance, and I'd like to wish everyone a very good day.